And, we're going to talk about COVID vaccines, which, to say the least, has been a pretty contentious subject lately. So we want to share with you guys our thoughts and views on it. We are not affiliated with any large organization. Most of you who have worked with us know that we actually work outside the system. In a lot of ways, we are very anti-establishment. And, we believe that healthcare can be done a lot better in our country. And that's why we are doing, things very differently. And most of you guys who have, interacted with us, gotten care with us over 2 years now. Hopefully you guys have seen that, our goal when we provide care is to provide that care in a very non-judgmental fashion, that we genuinely care for your well-being, and we want you guys to stay healthy. We have no affiliations with anybody. Whatever we say, these are our own views, and they are purely to help you all as our members. And our goal is to keep you guys healthy. We've been really busy in the last few weeks as outpatient, and there are a lot of our colleagues, friends, relatives who are really busy working in the hospitals. You guys have seen this Delta variant wave of COVID-19. It's devastating a lot of families, and vaccines can play an important role in slowing that down. Personally, in our clinic, we have vaccinated over 500 people. More than half of our members are already vaccinated, which is close to 1,500 people. And what we are seeing right now in the community is, in general, infection happening in unvaccinated folks. And that's what the data is coming out of hospitals as well. So we just want to talk about it. We want to hear your concerns. Obviously, it's not good to force people to get vaccines, but I think it's important to have a dialogue which is open. So that's what we are hoping to do. Please, like I said, ask your questions in the chat box, type them, I'll be watching it, and we will address it at the end of this talk. So I'm gonna hand this discussion over to Dr. Wertz, who's my colleague. She's gonna go over some basics of COVID and COVID vaccines for the next few minutes, and then we'll do some Q&A. Thank you again for joining this morning. Dr. Wertz.
All right, thank you. Very good introduction. So the way I wanted to formulate or format the talk was kind of the questions that I get from people, or the questions that I thought maybe some of you might have if you are part of the group who perhaps hasn't been vaccinated so far. And one of the ones that has been around since the beginning of this is, why should I care if COVID is a mild illness and high chance of recovery, low death rate, no biggie, right? And I think, there was one answer for last year. There's kind of a variant of the same answer, but there is kind of a difference of what's going on now compared to what was going on last year. So the pandemic of 2020 versus the pandemic that kind of started up in July and that we're facing now. This Delta strain is at least twice as contagious. The numbers are out of control, both for adults and peds, hospitalizations, deaths, and maybe, data is still coming in, but maybe that mortality is higher with Delta too. And even, looking at the data from our med center hospitals, which, these wonderful charts that, I'm sure nobody really wants to look at, but all these, peaks and bars, and, I'm not really a big graph person, but these waves, I call them doom and despair, and then Delta there on the far right. But that's our little summer surge on the left, and then our winter surge. in the middle that was the worst. But looking, and the thing that I think is important to draw from this is looking how quickly our numbers have come up with this Delta wave. We've certainly surpassed that summer surge already in the matter of just a few weeks. And we're almost even to the peak of what we saw numbers wise in that winter surge. So just really suggesting that we're kind of in for it with this. And then looking at, the big problem of that's a lot of patients that are sick. And what are we going to do with them? And even thinking that, our med center hospitals, our Houston hospitals are busy hospitals. And even on good days, even pre-COVID, back to the good old days where there was no COVID, all of our hospitals are busy hospitals. They tend to run pretty full, even almost full on normal days when there's no COVID. And now we have all of these COVID patients to take care of on top of all of our ordinary patients, right? And when COVID came to town in 2020, it didn't stop by and say, hey, heart disease and, accidental trauma, you guys got to cool it for a while because we're going to take up all the beds. All those things are happening too. So trying to care for everything all at once is a bit of a strain on the system. When, all of this started to happen even last year, all these, big wigs at the hospitals came up with a plan of how are we going to do this, and making extra beds. Making extra beds is one thing. You also need the staff to take care of the people in the bed, right? But looking at where we're at now, the first phase of ICU beds is 100% full, and 37% of those are COVID patients. The second phase of making extra beds is 85% full, and 29% of those, almost a third, are COVID patients. And now we're on to phase 3, and 65% of those are full, and almost a quarter are COVID patients. And that was kind of the end of the plan. And we're 65% full. So, somebody's got to do some clever rearranging to come up with more space. And this is where you see tents coming up outside of hospitals right now. It's happening outside of LBJ. It's happening in lots of outlying hospitals in St. Luke's Woodlands, Methodist Willowbrook, all of these places that you just would not think that would be happening in Houston. And then I put this just as a sake of comparison point so we can see the change that's happened. So just letting us know again that this is different. We're in a different position than we were. So thinking about our test positivity rate, that's at 14%. Last month it was 4. Our new cases that are about 3,000-ish per day, testing positive in the whole Houston area. Last month it was 400. Our hospitalizations that are 375 per day. Last month it was 58. So, again, just, hey, we got to stop. We got to think about this. Even if we had a different idea last year or 2 months ago, it's different now. And so just thinking about it where we are today. The other is kind of in that thing of where are we today? We have moved into sort of a tale of two pandemics, a tale of two cities. And, if you're a Dickens fan, where we are in a tale of two pandemics, there is a whole different story for vaccinated people versus unvaccinated people. Vaccinated people are not getting sick nearly as often as the unvaccinated. And when they do get sick, they're getting a very mild case. They're not showing up to the hospital. They're not dying. This data basically goes state by state, and it all looks the same. The middle column is the people who've been fully vaccinated, and their percentages are very low versus the people on the right column who are not fully vaccinated. Is just about everybody, all the high 90s. Those are the people who are getting sick with COVID. And then likewise, this is the death chart. And you see the people who are fully vaccinated are not really contributing to the deaths. They're like a percentage versus the not fully vaccinated people. And that's exactly what we're seeing in our hospital. 97% of people in our hospitals in Houston are unvaccinated. And that's where the deaths are coming from as well. The other thing kind of in the same kind of talking about numbers is, this notion that COVID isn't affecting our kids. And it surely has this whole way through. 4.3 million kids have tested positive since the start of the pandemic. That's a lot of kids. I surely don't want it to be my own kid. As of just August 5th, 14.3% of all cases are kids, and they've had their own spike over this last week. Like we've had a spike of 93,000. And this is their chart, which just shows that all along the way with each of these same peaks, those are the same waves that, the doom, despair, and delta, their waves follow our waves. So the same thing is happening with them. And the problem too, that affects us, obviously their problems affect us in a lot of ways, but in prior surges, we've used the pediatric hospitals to put adults. That's been part of our overflow plan. The pediatric hospitals are now full. So then the other super good question is, are vaccines safe? We're going to say, okay, look, it looks like you really need a vaccine to protect you. Well, then you've got to ask, surely, is a vaccine safe for me, right? That's a really good question. And first off, of course, no vaccine, no medicine, nothing in life is really safe, right? How'd you get to work today? How did I get to work today? You drove a car probably, right? That is not safe. It is not safe in Houston. But what did you do? You tried to mitigate those risks somehow, right? You didn't get in your kid's power wheel or on their little tricycle and ride down 59, right? Your car probably has working brakes. You probably used your seatbelt, or at least you knew you should. And that there's lots of data to prove that seatbelt decreases the risk that you'll die if you're in a car accident. And you have airbags and, all these other things. You have working brakes. And that's kind of what it's like. It's layers of protection, right? And so I would think about it the same way. Your vaccine is a big layer of protection. And I would think about that maybe as your seatbelt, and then your airbags are a layer of protection. And so maybe that's your mask. And then that your brakes work, maybe that's social distancing, right? It's all these layers to protect ourselves. But, the vaccines, the other big thing to think about is we've had these things out for almost a year now. Hundreds of millions of doses have been given, and there's no clear pattern of any serious or unexpected adverse events that have occurred. That being said, they are reactogenic vaccines is what we call them. So we do expect when you get your dose that you're going to have a reaction of some sort, probably, meaning your arm will be sore, you'll have a little fever or something like that. And it's just because those vaccines stimulate the immune system. And to some extent, that's what we want. And it's kind of a good sign. But as far as thinking about serious things that could go wrong, one question could be, what's this myocarditis and pericarditis that I hear about? That sounds terrible. And inflammation of the heart or inflammation of the sac that's around the heart. That does sound terrible. I agree with you. And I wouldn't want to have that either. But putting it in actual context. So, one big study that's looked at this was 2 million patients, and about half and half between people who got Pfizer and people who got Moderna. And 20 people had vaccine-related myocarditis. Out of 2 million people, 20 people had myocarditis from their vaccine. 37 had pericarditis from their vaccine. So, we have to think about this in context. These vaccines are under a microscope, right? Everybody is so worried. We're looking at it so intently, but we have to think about it in the right context. Likewise, we got real excited about allergic reactions, especially early on when we first started giving it and worrying about the potential for anaphylaxis for a super bad allergic reaction. Is the throat going to swell? Are people not going to be able to breathe? That happens in 2 to 5 per million vaccines given. So that's not a lot. And in comparison with penicillin, everybody loves antibiotics, right? And penicillin is a good old favorite. 1 in 10,000. So much, much more frequently, it could happen with a standard antibiotic. And even the anaphylaxis, we're prepared for that. That's something that, is a kind of expectation of anything that we give, and we're stocked and ready to treat that if it should happen. So that doesn't have to be a huge concern. Serious adverse effects with J&J, there's a couple extra things to think about. There is a condition called thrombosis with thrombocytopenia syndrome, which is basically blood clots with low platelets. This was only noted after 7 million doses were given. And as of May this year, 28 cases were reported. So again, super low likelihood kind of thing. Guillain Barre syndrome, which is a neurologic condition that affects the nerves where there's abnormal sensation and a paralysis that develops. But again, only noticed after 13 million doses were given, and there's 100 cases that are being investigated. Seems like maybe it's happening at a rate that's 3 to 5 times higher among the vaccine recipients than the general population. So both really low likelihood things. And the FDA's kind of final statement for this is the known and potential benefits outweigh the known and potential risks, which seems fair, right? Because these are really, really low risk things. My personal take on this, and again, like Dr. Goyal said, these are personal opinions, is the mRNA vaccines don't have these things. So, if these are super low risks, you could just say, I'm not going to take those risks and get the other vaccine. Then I hear the series of statements that fall under the I can't trust the vaccine. And one big one is that it's rushed. And my initial answer used to be something of, that it was, just delightfully sped up. Lately, I've just been thinking, man, it's impressive. In a year that a vaccine was put together, that's really impressive. And it kind of upsets me that if we would get our stuff together and work together, the things that we could do, honestly, and the impact we could have on all sorts of diseases, but really just that people came together, worked on one common problem, and wanted to get something done quickly. And it could happen. There was money to do it. The government got involved in a positive way, got rid of some of the red tape that slows things down. They were able to recruit volunteers quickly because people wanted to be involved, wanted to help, because it was impacting them on a big personal level. And then that, it was easy enough to hit the endpoints, that there was plenty of COVID happening to show that the vaccines were working. The other big question is, the concerns always of what's in a vaccine and, what is going to cause a problem other than, what the vaccine is doing. And importantly, it doesn't contain the things that people are usually concerned about, meaning there's no eggs that you can have a reaction to, there's no preservatives, latex, or metals. The other one, which has been kind of brought up a lot more lately, is why isn't it FDA approved? And if it's not FDA approved, then why should we trust it? I just kind of maybe a little snarky versus devil's advocate, but neither are herbal supplements or CBD products or ivermectin or hydroxychloroquine or, lots of other things that people still want to do. So yeah, I feel like you can't pick and choose when you want something FDA approved. But really full FDA approval is a lot of work, and versus an EUA, an emergency use approval, it's like 10 times the amount of paperwork to review. It's thousands of pages of documents. Usually it would take them like 6 to 8 months. But with this, instead of, if there was a new vaccine, like Zika vaccine, there's a Zika vaccine that they're reviewing, they would get this data and then the trial is over and they would be able to review that data, and then the vaccine would be approved and it would go out to the population, right? With this, they got data and they approved it very quickly, and then vaccines went out, right? And now they're still getting all the data. They're still getting all the things that you and I are reading, right? So they're reviewing all these things at the same point. So they're just inundated by data, essentially, and they're reviewing all that. And they want to answer all the same questions we want to answer. Are there more adverse effects? Or are there, or is the immunity going to disappear? And so they're looking at all that. And I think it's a tricky balance between approving it so we feel better about it's approved fully, versus if they approve it too quickly, do we trust that? And do they have to maintain their standards, right? So it's a tricky balance. But Pfizer has applied, and the FDA has said that they're trying to approve it by Labor Day. Moderna only applied in June. So, I also think we've been blaming the FDA when Moderna only applied in June. FDA wants more data from them. J&J hasn't even applied for their approval. The other, which I kind of think is one we need to let go of, is I don't want to be a guinea pig. I don't want people to experiment on me. I mean, the trials have been done. 4.43 billion doses have been given worldwide. 351 million doses have been given in the US. 4.5 million doses have been given to your friends and neighbors in Harris County. So I think we've been giving enough doses to say that it's not an experiment anymore, and that people are doing okay. Variants. So this is kind of course, where we are now. And just for a quick statement on what variants are, and viruses mutate over time. It's what all viruses do. That's why we need a new flu shot every year. That's why HIV is a problem and hard to treat. Viruses change in some sort of way, and that might change the disease severity. It might change mortality or death rates. It might make it harder for vaccines. It might make it more contagious. And with the Delta variant, what we see is, or what we're suspecting is that maybe it is a little more severe. Maybe the mortality rate is up. It does seem like it's got a little bit of weight slightly around the vaccine. The vaccine isn't as perfect, and it definitely is more contagious. Whoops. Okay. But I think, and so this chart shows kind of the variants of concerns that we've had, alpha, beta, gamma, and then now delta is this last column, but it kind of doesn't matter. Delta is, of course, all we're focused on, but this game is going to keep playing, right? It's going to be variant after variant after variant until we get this under control. Vaccine efficacy against the variants. The short story is there's lots of studies. We can look at this in different ways. We can look at antibody titers. We can look at how the immune system responds to the variants. We can just look at how people do, do they test positive? Do they get symptoms and end up with COVID? And with all those studies that have been done, there is a slight decline in how effective the vaccines are, but the vaccines are still very good at preventing severe disease. And here's just one study with one data set for Pfizer. And in terms of preventing against symptomatic infection with Delta, one dose of Pfizer really is no good. You're 30% protected, you're not going to get anywhere. 2 doses, 88%. So versus the initial data where you were like 95% protected with Pfizer, it's down to 88. Effectiveness against hospitalization is 96%. So again, back to that notion of protecting you against the severe big bad stuff. What about the people who've already had COVID that say, oh, why do I even need a vaccine? Well, natural immunity is just messy, is probably the best word. And that's really all I could come up with. It's just more questionable. It's going to vary more between individuals. It's even going to vary from one infection to the next. If the infection is more mild, you might not get as much of an antibody response. And we really even, of course, we've got no way to measure it now, but we really just don't even know what level we would want it to be, versus other infections. We have very clear targets. If somebody is going to work in a hospital and we have to prove that they're immune to chickenpox, we have a test and we know exactly where they need to be to say, oh yeah, they're immune, they can go work in the hospital, or they're not immune, they need an immunization. The other is that the immunity, we know it fades over time. We don't have any precise timeline to say, in 3 months you need your vaccine. It's different. So it's hard to know what to do. And then the immunity, it's probably almost certainly not going to hold up to variants, right? If you had COVID just in April, May, maybe even June, now Delta rolls around, you're not protected. Versus vaccines have been shown to be consistent across age groups and different patient populations. That studies show that people who've had the vaccine have a higher antibody level than people who have had a natural infection. And the antibodies that you get after vaccine have more binding options. They can bind to more places. Versus people who've had natural infection, those antibodies really only have one option. So when the strains change, when the variants develop, that's why it doesn't work as well. And then there's less likelihood for reinfection. So Dr. Klotman, the president of Baylor College of Medicine, showed this in one of his videos, and I really liked it because I think it just kind of, I don't know, it just makes sense in my head a lot. But if you think about antibody titers in kind of a bucket, and if you start from the bottom of the bucket and the bottom dashed line is the original virus, and, we didn't know it then, but that was the simplest, and you needed the least amount of antibodies to be able to knock that off. And then the alpha variant, when that came from the UK, you needed a little bit more antibodies. And then that first red line is what the antibodies that you get when you have one mRNA vaccine. AZ is AstraZeneca. We don't give that in this country. And then that top dash line is Delta. So you see that with each of these strains, they get a little more complicated and you need more vaccine. That next red line is where you tend to be on average with a natural infection. So average, some people will be a little better, a little higher. Some people are gonna be a little lower, but it's just barely past that Delta infection. So, that's probably not an ideal place to be. That's a bit of a gamble. J&J is enough ahead of that it's probably you're good. The mRNA vaccines are much higher. They're really at the top of the bucket. It's not really clear if that matters or not, but you could kind of wonder, if you start higher and then immunity does wane, does that help you by giving you more time? But nobody really knows that. And then, this is a reasonable question too, but what's up with these breakthrough cases and why is it happening if vaccines are so good, right? But breakthrough cases were always expected, right? Nothing's ever perfect. And, these vaccines weren't 100% effective. Even the original data for Pfizer, 95% effective, 5% was not effective. And now that Delta's gotten a little smarter and it's only 88% effective, 12% not effective, right? So the breakthroughs seem like they're happening at an expected rate, at least so far. I mean, it's been like a month of this, right? But, looking at little bits of data here and there, since July 26th, 163 million people in the US have been fully vaccinated, 6,500 breakthrough infections, 0.004% of people. That's pretty teeny tiny. And then 1,200 of them have died, 0.008%. That's teeny tiny compared to what numbers look like of people who are unvaccinated. And people who are vaccinated at that are having milder symptoms. And then, okay, then you can also have the argument of, well, it's how much is the vaccine helping me? I'm still getting sick. So why should I bother? And then, you can think a step ahead of, okay, yeah, you do still get sick, but you're less sick, if you will. The vaccine attenuates the illness, less risk of febrile symptoms, 58% lower. Your duration of illness is shorter, 2.3 days less spent in bed. I mean, if I have to be sick, I'd rather be less sick and sick for a shorter period of time. Makes sense to me. I mean, I got stuff to do. Boosters literally super hot off the press of I was trying to finish this last night and 10 o'clock, the FDA thing comes across and I had to add this in. So there's a panel to decide eligibility today, but Pfizer and Moderna are going to be authorized to give as third dose to people who are immunocompromised. So definitely people who've had an organ transplant and whatever is determined to be equivalent level of immunocompromise. Other countries, Germany, Israel, other places are doing this already. Whether or not it's going to be other people kind of remains to be seen. Scientists, people are kind of divided on this. And then, the people that just literally look me in the eye and say, I'm never getting the vaccine ever, or I'm not going to take that risk. I'll take my risk to get COVID. I just like to say, okay, if you're choosing your risk or you're choosing not to take the risk of COVID, you got to know you're choosing the risk of getting COVID and all that means. So think about that. You're thinking about spreading it to others. Think about your family, think about your kids, especially the kids who can't be immunized and are at risk. Think about those immunosuppressed people. That's 3% of our population. Think about your own risk now, knowing that hospitalizations are a big factor there. And what's that going to mean to you? Are you going to lose income while you're in the hospital? Hospitalizations tend to be long with COVID. Are you going to lose your job altogether? Is it going to be long recovery? Are you not going to recover all the way? In hospital mortality is pretty high, 9%. Post-COVID syndromes, which I'm going to touch on in another slide, but that now officially counts as a disability. And then, of course, the return to normal of economy and social events and all those things. Post-COVID syndromes, I feel like we could talk about this alone for an hour. people with COVID, and most of this came from a big study of like 70 something thousand people from the VA system, have a higher risk of death, even out to 6 months after their COVID diagnosis. And even for people who are not admitted to the hospital, people who were just outpatients with COVID. And the outpatient people, it was 8 per 1,000 patients. People who were admitted to the hospital is 29 deaths per 1,000 patients. And then people who had COVID were more likely to require healthcare resources. So they had an extra half visit, the outpatients, meaning people who weren't admitted with their COVID had an extra half visit. So a visit every other month to see their doctor after their COVID. And the people who were admitted to the hospital had a visit and a half every 30 days. So you're done with COVID and you've still got issues taking you to the doctor once, twice a month. And then a broad array of new clinical manifestations. And these are things you didn't have before COVID. And all of this is happening a month afterwards, after your COVID diagnosis. And it literally is touching every system. It started at the top, work your way all the way down to the bottom of the body. Neurologic problems, respiratory problems, heart problems, GI problems, musculoskeletal, everything. An increased risk of several new classes of medicines, meaning you weren't on those medicines before. 30 days after you had COVID, you're on medicines, inhalers, pain medicines, diabetes medicines, blood pressure medicines, and the list really just went on and on and on. And I think the most important thing out of this was that it is not just the sick. It is not just the people that were in the hospital or the people who were in the ICU. It was the majority of people, the outpatients, the people who have even the mild symptoms. Those people get these post-COVID syndromes too. There was a risk and associated burden, as the severity got worse. So if you were the outpatient, you got stuff happened to you. You had higher risk of death. You had more outpatient visits afterwards. You had new clinical problems. You had new medicines, but you had more if you were admitted to the hospital or if you were admitted to the ICU. But it was there. The other thing that in this study that they looked at was comparing the hospitalized COVID patients to people who were hospitalized with seasonal flu. Back to that question of, isn't it just like the flu? And they saw higher burden of various clinical manifestations. And that's this chart here. If you just look at the right column and see all those pinkish, purplish bars going out to the side, all of those represent excess burden of whatever problem. And each category, cardiovascular problems, skin problems, hormonal problems, GI problems, the list goes on. This is not like the flu. The flu doesn't give you all of these problems. The flu doesn't give you heart disease, heart arrhythmias, blood clots, right? This is different. And then the last thing that I'm really sorry to still be talking about 15 months into this, but masks don't work. I still have this conversation. Masks do work to reduce transmission. It's all about layers of protection, right? It's back to your car, and the airbags and the brakes and everything else. Mostly they prevent infected persons from exposing others by blocking exhalation of virus-containing droplets. And the important thing here is 50% or more of transmissions are from people who don't develop symptoms, or maybe people who are in pre-symptomatic phase. And masks don't block 100%, but they block maybe 50, 70% of those little droplets. And if you're the wearer, if you're fine, then that might, you might be able to block larger droplets that could land on you, or they filter out smaller droplets. But the effectiveness is really in terms of source control. And for some reason, we keep doing the same study to try to prove that. And that's what all these are, if anybody wants to actually reference those. And then this, perhaps, light at the end of the tunnel of my talk, or It's the sun going down on a COVID tent outside St. Luke's Woodlands. But that's all I have. I'm super glad to take any questions if anybody has any.
Thank you, Dr. Wertz.
Sure.
So, again, I think the general message is, yes, vaccines, we should be carefully evaluating them. And on a case-by-case basis, you kind of weigh your benefit risk ratio. But in general, getting COVID is way more harmful than getting vaccine. And so not only for personal reasons, you should consider strongly getting it, but there is also of doing our part for the general community. I'm all for liberty and freedom, but I think with liberty and freedom also comes responsibility. We are going to be coming to New Era offices next week. I believe Wednesday. We will have vaccines, both J&J and Moderna. Please reach out to Melissa if you guys want to get vaccinated. It really can't get any easier than that. Or if you guys just want to stop by and discuss, if you're still on the fence about it. But again, we've been extremely busy in the last few weeks trying to take care of people who are sick, unvaccinated, and it's just very disheartening sometimes to see all that and to see all the suffering that comes with it, where we feel like it could have prevented at least most of it, if not all of it. So thank you again for listening. I'm going to read some questions here or comments. So let's see. In regards to myocarditis, a family member of mine has had that previously and led to a heart attack. Would you recommend that they get vaccinated given their history, or should they hold on? I actually had a patient who, as a kid, had myocarditis due to a totally different reason. And we did end up vaccinating the child. He's about 18 years old now, going to college, and he did fine. So I think those are two independent reasons of potentially getting it. I don't think, previous history predisposes you to getting it again because of the vaccine. So I do think you should get it and maybe consider getting J&J, where the incidence of myocarditis is not as much as it is there in mRNA vaccines.
That's a good point. Yeah, and even in the mRNA, that trial that I showed, or that study that I showed, of those people that had myocarditis, there were several that ended up getting their second shot, and they did fine with the second shot. So I would still get it. I mean, you also have a chance of getting myocarditis from COVID. So it's, it's all about looking at risk and balancing your risk. But I would definitely get it.
Next comment is, I got the Moderna, but wish I never did. Have heart trouble you talk a little about, but not enough. At 90 pounds, and there have been more than 20 cases reported per my doctor, will always have trouble. Not sure I'm completely following this comment, but it sounds like you had heart trouble after one Moderna shot. What happens is when we talk about the adverse reaction reporting system, anything that happens after the shot, like 1 month or 2 months after the shot, gets reported. What is hard to prove is the correlation, right? If I take my car to a mechanic and he fixed something, but a month later, something totally independent happens and my car breaks down, I can think, hey, the mechanic did something, but it's possible that the second event had nothing to do with the first event. But you may still be right that there is some heart issue. If I don't know if you are a member, we would love to look into it deeper and figure out what happened. The data does show that most of the people who had myocarditis or pericarditis have completely recovered, and we do not expect any long-term consequences from that. Next comment is, I want my daughter to be safe if I get the vaccine when she can. I feel the same way. You know, we do what we can and hope for the best. Will this vaccine have to be repeated every year? You know, we don't know. What we are seeing is that immunity doesn't last forever. Over the months, it does. Right? But if most of are vaccinated, the spread will slow down, and the ability of the virus to keep mutating and keep, you know, showing up with new strains goes down. And that obviously will reduce the need for continuing to vaccinate, you know, over and over again. But at this point, you know, it's to be seen what happens. My dad received the vaccine, and there are some side effects that have not left. That worries me. Will just a booster or flu vaccine be available if possible? So I in fact had you know, few members who have reached out to me who got Pfizer, and Pfizer doses, total immunogenic dose wise, Pfizer is actually a lot less than the Moderna dose. So there is a study showing that breakthrough cases are happening a little more often in patients who received Pfizer. And so we've had a few patients reach out to us and they want to get a Moderna booster. There is no clear guidelines on that yet, but you know, the people who have gotten the booster already, few of my physician friends and few of the other patients, they've been fine. And so we'll see what time shows. Flu vaccines, you should get it. We already have started receiving it, and we'll be reaching out to all the employees when we are ready to start vaccinating for flu as well. You don't want a combination of flu and COVID at the same time. We saw a few cases last winter of that, and it is not pretty. My husband has multiple health issues and took the vaccine with no problems. I am glad to hear. Hopefully he does not get the COVID, or if he, you know, does end up getting it, he will hold up better with the vaccine. Which vaccine to get, J&J or Moderna? Please advise. Thanks. You know, either one, get at least one. If my general approach has been that if you've already recovered from COVID, you can probably get one dose of just the J&J. Moderna was shown to be more effective in preventing the infection, but as far as severe illness and hospitalization goes, the efficacy of both these vaccines is pretty equivalent and really good. My brother is a first responder. Anyone who they pick up, no matter what is listed as COVID, the numbers can be misleading. I don't know what to say. You know, we work in healthcare. There's so many people. We don't just label people as COVID. We got better things to do than that, I promise you. Are you recommending one shot over the other? Is one better? You know, like I said, all these three vaccines that are available, they are all really good at preventing severe disease. So either one, if you want one shot, J&J is there, but Moderna and Pfizer are also very effective. And again, overall incidence of adverse effects with all these vaccines are really, really low. Does research continue for new improved vaccines? Absolutely. Will the booster be any different from the initial vaccine? I'm asked because I'm trying to figure out how likely it is that there will be a shortage of booster shots initially, like there was with initial vaccines. That's a good question. I don't know. We'll see. Time will tell. Have you heard of any young people that did get the vaccine and having infertility issues? I have not. This is something that had started because a couple of scientists had reported some cross reactivity of the antibodies to the female reproductive system tissue, but there is no proven cases of infertility at all, much more or less so than other stuff we are seeing, like myocarditis, Guillain Barre, and stuff like that. I can tell you, I do know several people who got Moderna last year and now are, pregnant with a healthy, successful pregnancy. I was exposed to 4 people who just found out they have COVID, and all 4 had their full vaccines. I got tested, I'm negative. Do these already vaccinated qualify for booster? And, like we said, people with vaccines are definitely still at risk of getting COVID. It's kind of like, you go to a war, let's say, and you wear a bulletproof vest. Can you still get shot? Absolutely, you can still get shot, right? It's not going to prevent the shot from hitting you, but the chances of you making a life out of that war or a battle are a lot higher. And so it's the same thing with COVID. And in our personal experience, people who are vaccinated, they are definitely having a lot milder disease. And data clearly shows that very few people that have, ended up in the hospitals or in the ICUs are actually vaccinated. I'm trying to push my siblings to get the vaccine. When will the FDA finally approve the vaccine? We touched, Dr. Wertz touched upon this a little bit. Obviously, the emergency use authorization is already there. The process of full authorization, just the red tape that's around that, it takes long. I do agree with you that FDA needs to fully approve these vaccines. And we are hoping that they'll get around to doing that over the next few weeks. Okay. Can we have frequent antibody tests to ensure immunity levels? Yeah, I think, you can have antibody tests. I'm not sure how frequently we need to do them. Yeah, for sure. Okay, so thank you again for the participation. Again, most of you guys are hopefully our members. If not, please join us. And like I said, we will be out at the New Era offices next week with the vaccines. And whoever is not vaccinated, please come get the vaccine, or at least come have a conversation and we can discuss. Otherwise, if you still choose not to get the vaccine, please at least try to social distance and wear a mask. We only wish you the best. We just want to keep you healthy, and we really have no other agenda behind this. So with that, you guys have a good rest of the Friday and a